Dear students, welcome back. In the previous session, we have discussed about intervertebral disc. Now, in this session, we are going to discuss about what are the articulations found in the spine or the vertebral column, and mainly in these articulations. In this session, we are going to discuss about two main types of articulations. One is the cartilaginous joints of the symphysis type, or it is also called as secondary cartilaginous joints. And next one is the diarthrodial or synovial joints. Okay. First, we will see where such kind of articulations are found in the spine or in the vertebral column. Okay, so now the first type is the cartilaginous joints of the symphysis type or the secondary cartilaginous joints. Normally, these joints are present between the vertebral bodies. So between the vertebral bodies. So here you can see this is between the vertebral bodies, including the interposed intervertebral disc. So here and here, these are the interbody joints, that is cartilaginous joints of the symphysis type. So here the joint formed between the either it may be the superior plateau of one vertebral body or the inferior plateau of the other vertebral body, which forms joint with the intervertebral disc. Such kind of joints are called as interbody joints. This interbody joint comes under this cartilaginous joints of the symphysis type. Now the next one is the diarthrodial or synovial joints, which occurs or which are found between the gygapophyseal facets located on the superior articular processes of one vertebrae and the gygapophyseal facets which is located on the inferior articular processes of an adjacent vertebra which is located above the previous vertebrae. Okay, so the joints present in between these facets are called as gygapophyseal joints, and these joints are synovial joints. We can see such kind of interbody joints and gygapophyseal joints in the vertebral column from C2 C3 level to L5 S1 level. So throughout the vertebral column we can find from C2 C3 to L5 S1 mobile segments, we can find such kind of joints. Okay, and the vertebral column also articulates with other bones. Okay, so these are also synovial type of joints. Okay, so the vertebrae which are present in the thoracic region articulates with the ribs, forming costovertebral joints. So I have explained this costovertebral joints in detail in thorax and chest wall biomechanics. Okay, you can refer these joints there. But in this session, we are very much particular about interbody joints and the gygapophyseal joints. Okay, and the other articulation of the spine is articulation with the skull. Okay, so the first cervical vertebra articulates with the occipital condyles of the skull. Okay, this is one articulation. This one is also a synovial type. And another one, the vertebral column articulates with the pelvis. Okay, at the sacroiliac joints. So the vertebral column articulates with the pelvis at the sacroiliac joints. If you see the sacroiliac joints which are partly synovial and partly fibrous type. So these are all the articulations found in the spine. Okay, now we will see the interbody joints in detail. Okay, yes, here comes the interbody joints. So generally the joint is a cartilaginous type. The type of joint is cartilaginous type. Here the joint formed between the vertebral body with that of the interposed disc. Okay, so such kind of joints is called as interbody joints, or we can call it as intervertebral joints. So why it is called as secondary cartilaginous type of joints? Here the connecting material, normally in the cartilaginous joints, the connecting material between the two components is a cartilage. It may be hyaline cartilage or fibrocartilage. So this one is the secondary cartilaginous type of joint, that to symphysis type. Here this one is mainly connected by the fibrocartilage. Okay, as we know that in the composition of the intervertebral disc, so normally in the intervertebral disc we have centrally located nucleus pulposus, and around this nucleus pulposus we are having another part called as annulus fibrosus, which are arranged in the form of layers, isn't it? So at the center over the nucleus pulposus some hyaline cartilage is present, isn't it? So if you see the vertebral end plates also, at the center of the vertebral end plates we can find this hyaline cartilage. So although some attachment with that of intervertebral disc at the center with the hyaline cartilage is present, but this joint is considered as secondary cartilaginous joint because the peripheral part of the intervertebral disc, that is annulus fibrosus, is connecting with that of the vertebral plates, that is the vertebral bodies. Okay, so with that of fibrocartilage. Okay, so if you see the most of the composition of the joint is attached by the fibrocartilage than the hyaline cartilage, so this joint is considered as secondary cartilaginous type of joint. So normally such kind of joints are found in our body, in the midline structures of our body we can find such kind of joints. Normally these kind of joints serves as weight bearing joint. Okay, and it is responsible for withstanding and transmitting forces. Okay, so under normal conditions a very little or no motion is present in such kind of joints, but in between this interbody joints we can find some little translations and rotations of one vertebrae over the other vertebrae we can see in interbody joints. Okay, so what are the available movements at the interbody joints? Means it includes sliding. So one is sliding, another one is distraction and compression, and another type is the rotation. So these are the different types of available movements in between the interbody joints. Okay, Now, the sliding movements can occur in the following directions, that is anterior to posterior. So this one is anterior to posterior. Sliding motions can occur, and also medial to lateral also we can find this sliding motion, and some sort of torsional type also we can find. And the tilting motions, the tilt motions or the rotatory motions can occur in the anterior and the posterior type, and also in the lateral directions. Okay, and also some type of motions, that is compression and distraction movements are found, that is called as axial compression. So this is called axial compression, and this one is the distraction movements or seen in the interbody joints. So all these constitute 6 degrees of freedom. Okay, and the amounts of each of these motions are small and vary by region according to the structural differences in the discs and the vertebral bodies, as well as the ligamentous support. Okay, so if you see this translations and rotations of one vertebrae in relation to an adjacent vertebrae in detail, so we can, if you see in the A, this is called as side to side translation, which occurs in frontal plane. And B, if you see, this one is superior and inferior translation, that is axial distraction and compression, which normally occur in vertically. And another one, if you see in the C diagram, anterior and posterior translation occurs in sagittal plane. And if you see in the D, this one is rotation, that is tilting. Okay, side to side tilting, D is called as side to side tilting, occurs in the frontal plane. Okay, in the frontal plane. So that means the movement which occurs in the frontal plane, then what is the axis? AP axis. Okay, next rotation occurs. Here you can find the rotation occurs in the transverse plane around the vertical axis. The vertical axis may be the sagittal axis or the coronal axis. And AP rotation, antero-posterior rotation, if you see in the F, so what is happening, which occurs in sagittal plane around a frontal axis. So these are all the available motions in different planes and axes in the interbody joints. Okay, in addition to these movements, the zygapophyseal joints influence the total available motions of the interbody joints. Not only the movements which are taking place in the interbody joints is not enough to form the total motion, and also the motions in the zygapophyseal joints are added to this interbody joints to form the total available motion at the interbody joints. So now we will see how these zygapophyseal joints are formed. Okay, so this is the zygapophyseal joints, which are also called as facet joints, and also it is called as epiphyseal joints. Okay, so these joints are formed in between the facets. Okay, that means it is a facet joint which is formed by the articulation between a paired bony projections. Here you can see a paired bony projections called articular processes Okay, and these processes are located on the back of the vertebrae and connecting the adjacent vertebrae. Okay, so here these are present on the back of the vertebrae, so which is connecting the other adjacent vertebrae. That means if you take a mobile segment, so this one is the superior and this one is the inferior part of the mobile segment. So this one, these are the inferior articular processes of the superior vertebrae is articulating with the articular processes of the adjacent inferior vertebrae, forms the facet joints or the zygapophyseal joints. Okay, so if you see for each disc space, there are two facet joints. One is at the right side and the left side. Two facet joints are present, and also a disc is present in each disc space. Okay, and such kind of thing is called as tripod, which creates the motion segment. Normally the spinal nerve exits just above the upper facet, exists just above the upper facet at each level. Okay, at the upper facet at each level. Okay, and this joint is surrounded by an outer capsule which is very tough, resilient and slightly flexible, and inside this capsule we can find 2 ml of synovial fluid for lubrication, and also and each facet within the joint, each articular facet is covered by an articular cartilage. Okay, and that one is encapsulated by thin fluid filled synovial membrane which facilitates smooth movement. Okay, and also prevents friction. Okay, and these zygapophyseal joints also have some intra-articular accessory joint structures. These may be of several types, but most are classified as either adipose pads or fibroadipose meniscoids, so which are present inside the joint, and these structures are most likely involved in protecting the articular surfaces that are exposed during flexion and extension of the vertebral column. Okay, so this is the structure of the zygapophyseal joints. So if you see the function of these facet joints, it allows a considerable range of motion. Okay, and also it absorbs the loads, and this joint provides support and also the proprioception. Okay, these are all the functions of these facet joints. Okay, and so the movement of if you see the movements, if you consider all the zygapophyseal joints and the intervertebral joints of the whole vertebral column, have produced or they are permitting some motions called as flexion and extension, lateral flexion and rotation. So this is a flexion, extension, okay, and rotation, and also lateral flexion. These are the movements available in the entire vertebral column. But in the vertebral column, these movements are not occurred individually. Here the movements are coupled with other movements. Okay, Hence, the motions which are available in the vertebral column is oftenly explained in the terms of coupled motions. In the next video, we are going to discuss about this coupled motions. Thank you.